Hello and welcome to Let's Talk, a series of podcasts produced by the Hazel and Betty Ford Foundation on the issues that matter to us, the issues that we know matter to you too. Substance abuse prevention, research, treatment for addiction, recovery management, education, and advocacy. I'm your host, William Moyers, and today we have a story of hope brought to us by Nina. Hello, Nina. How are you?
I'm good. How are you?
Great. Good to see you again. I know you've done a number of public events, if you will, or stood up and spoken out using your own story to help unmask the stigma of addiction and promote the reality of what we look like and the fact that treatment works and recovery is possible. And we're glad that you're with us today on Let's Talk. Tell us a little bit about your first experience with substances.
Yeah, thank you for having me. So my first experience was really the one that ultimately brought me here. For my own, in my life, my dad was an alcoholic growing up. For me, I had an injury which ultimately ended up, I ended up getting prescribed narcotics, opiates, and I enjoyed them well beyond using them for pain.
How old were you then?
It was about 7 years ago.
Okay.
So.
Yeah, 7 years ago.
Yeah. And, you know, kind of before I knew it, I was enjoying them, you know, kind of like my whole mind, body, spirit, everything. And it ended up becoming, you know, full-on addiction, which I thought I was immune to for whatever reason. I was not, and I was physically addicted. It got to the point where I couldn't use them. I couldn't not use them without getting sick.
And the irony of it is that you were working in the healthcare field. At some point along the course of your addiction. You're a nurse.
Yep.
Talk to us about being a nurse who was struggling with substances.
Yeah, it was really hard. I had, I knew I knew about addiction. I knew about opiates. I knew all of those things, and I continued using them anyways. And I think I particularly felt a lot of shame because of that, and I had access to them in my workplace, and so I just didn't want to be the nurse with an addiction, and I think that was a huge denial piece for me until I ended up diverting narcotics from the hospital I worked at, ultimately ending in getting caught and resigning.
And that diversion was so that you could sustain your own addiction.
Yes, very much.
How did that make you feel when you were under the influence, when you knew what you were doing was not only wrong, but was actually illegal, and yet you couldn't stop?
Just the powerlessness of it, but also in active addiction, it wasn't a matter of right or wrong, because for me, my morals and values have always included not stealing, but that wasn't, it was a matter of feeling normal or not, or, so I don't know that it was ever, I know I felt guilt, I knew at the end of the day it was wrong, but in the moment it was just what I needed to do, and, you know, and that's what I did.
And then in 2017, as you noted, you were caught, you were terminated.
Yes.
Or resigned. Yeah, you left your job, and you went to treatment. Did you have any doubt in your mind that you needed treatment?
Not at all. And I think honestly, it was a relief once the shock of it all, of losing not only what I used as my coping mechanism, but losing what I had worked for so long. I've always wanted to be a nurse, so I think the shock of losing all of that wore off. It was a relief. I didn't have to keep covering my tracks. I didn't have to keep wondering where I was going to get my next fix from. Somewhere in there was relief that I did get caught, so I could go get the help that I needed.
And you got that help. You got that help at Hazel and Betty Ford.
I did.
In Minnesota. And that help included, how long were you in treatment?
28 days in
then,
inpatient.
As an inpatient, a residential, and then you transitioned into a step-down program?
Yep.
Okay.
Like an IOP, intensive outpatient, called Core 12, specifically for opiate addiction.
Core 12, COR, which is
Yep.
Comprehensive Opioid Response hyphen 12, meaning
Yep.
the 12 steps,
Yep.
because you had an opiate addiction. And that Core 12 meant that you were prescribed as part of the treatment regimen, what?
Suboxone.
Okay. Buprenorphine.
Yep.
Yeah.
Yep. That started during inpatient and continued through outpatient and into my life now. So, and that was huge for me personally. I think, after, they kind of call it the bubble of inpatient treatment where everything's safe. After that, there's all the trials of life that come, they
Still
didn't
happen.
stop. Yeah. So that was a big support for me.
Right. And that trial of life for you included having to come to terms with the fact that you were going to lose your license as a nurse. Is that right?
Yep. So I got a letter in the mail saying that my license was suspended, which during inpatient, I was part of a healthcare professional group. So I was able to be around people who were similar to me, which was a huge deal. But also, I kind of learned what to expect for what was going to happen next for me as a nurse. And so I kind of was prepared for that to happen. It was still really hard. But I also, in all of that, got a phone call from the DEA, which was so scary, that I was being charged for what happened at the hospital and diverting narcotics. And so, like I said, just having all of that support was a huge deal, but it was like two very big things
Right.
for me that were very scary that I had. Ultimately, I had Core 12, I had my counselors, I had my sober. I mean, there was so much support around me that helped me get through that.
Wasn't all hard though. I mean, along the way
No.
you became a new mom.
I did.
What's that been like to be a sober mom?
Oh my gosh. It's been so great. I'm able to experience these things, and whereas all my energy before was being used up by when I'm going to use next, where I'm going to get it next, what I have to cover up, all of those exhausting things, I'm totally able to focus on my son and my husband and where my life's at now, and it's so great, so rewarding.
What has motivated you to be public about your experience, both on the substance use side and on the recovery side? The fact that you were and still are a nurse, you want to continue in that profession. But it takes a certain person who has that willingness to stand up and speak out. You were on the stage at the Hazel and Betty Ford Foundation in Minnesota when we had the drug czar, the director of the Office of National Drug Control Policy, on the campus to meet people like you and to talk. And there you were on the stage in front of the drug czar and in front of a big group of people. Here you are on a Let's Talk podcast, being seen and heard by thousands of people who want to know more. What is your motivation for being public?
A couple different things. I think the being a nurse part, when that all started, I think I mentioned this, I felt like I was the only nurse on earth who was going through this, who was, getting caught doing something criminal that I was very ashamed of, with an addiction in general, who was dumb enough to use narcotics and become addicted to them. Those things for me held so much shame. I mean, so much. And when I got to Hazelden, I remember in the detox unit, there was a nurse there that had gone through a very similar thing, and hearing she was the first person who I talked to that had ever been through that, and that was so big for me. And then, like I said, there was many people along the way who had been through similar things, and then people sitting right next to me that were going through the same thing. Mm-hmm. So just being able to tell people that you're not alone in addiction, but being a professional in addiction. Also, the stigma was a big thing for me, even though I grew up around addiction, and I knew it to be a chronic disease. I also know that in the healthcare profession, it was not always seen that way. And that makes it hard to want to get help. That makes it hard to want to admit to what's going on and go get that help. And that was the best thing that happened to me. And I at first, because I was caught and had to go to treatment, it wasn't necessarily a choice, but it was ultimately my choice to go. No one was telling me that I had to, but that it's okay to stop what you're doing and go take that time for yourself and treat your addiction and move on and be able to live a healthy life.
So where do things stand with your dreams of continuing to pursue nursing? Or do you have your license back? What do you have next planned?
I don't have my license. It's still suspended right now. I'm in the process of getting it back and working with the board on what that looks like, if there's going to be, restrictions or what that looks like, but I will have it back. And then from there, I really would like to get into the addiction, medical profession in some way, whatever that looks like, because that was such a huge part for me. And I want to be able to share with people more one-on-one that they're not alone.
What is that message that you would leave our viewers with today? We know that there are a lot of professionals, including nurses, who are probably watching or listening to this Let's Talk podcast. But at the end of the day, we know that there are a lot of people who are just like you and just like me and just like thousands and thousands of people who have struggled with substances, don't know where the answer is, or looking for some hope. What's the message you have for people who are struggling right now?
I keep coming back to, and this was true for me, what do I have to lose? I had nothing to lose and so much to gain. Even losing my job, even without my nursing career right now, I have so much more in my life, and I'm able to experience so much more in my life. And the support is out there without the stigma, and it's so much bigger than I could have ever imagined. The support is everywhere once you are in the recovery community, and it's just taking that first step, and it's scary, it's intimidating, but it is so wonderful. And I really think it's the best thing to do for yourself, and that you're worth it. You can take that time.
Without a doubt, you are worth it, Nina, and we thank you so much for bringing your story of hope to our constituents at the Hazel and Betty Ford Foundation. On behalf of our executive producer, Lisa Stangl, I'm your host, William Moyers, and we want to thank you for joining us for another edition of Let's Talk, a series of podcasts that at the end of the day are always about hope and help and healing. We hope you'll join us again. Thank you.